You may think you want the truth, but the reality is that you can't handle the truth. This is effectively the decision that was made in the courts with regards to a Freedom of Information Act question raised by Dr. Clare Craig, who is a pathologist and has been a vocal advocate challenging many of the things around the pandemic. And in her Substack here, she breaks it down on the 7th of November about the outcomes of this case that were brought against the Information Commissioner's Office. And it required the UKHSA to release data. And she was particularly interested in three things: age at first dose of vaccine, COVID vaccine to be specific, date of each vaccine dose, anonymized, and the date of death, anonymized, and only for people over 20 years old. So this is what she had been after, and she was refused. And it's interesting. So I'll be coming into this discussion here, and I want you to listen to what she has to say, and I'll hopefully try and give some clarifications as it goes along. Let me know if you can hear this in case we have any issues with our sound. And let's get straight into listening to what she had to say.
Hello, I'm Dr. Clare Craig. I've been trying to get hold of death data by vaccination status through an FOI, and I ended up having to take the Information Commissioner's Officer to court for not requiring the release from the UKHSA, who is the UK's public health authority. The judgment's now been made in that case, and they failed to require the UKHSA to release the data on people who died after vaccination. So I'm making this video, first of all, to thank everybody who was really generous in supporting the crowdfunding that meant this case could be brought forward, and also the legal team who did a faultless job. I'm really grateful to them too.
Pausing it here a minute, just in case you're not aware of the background to this and why I think, and this is my thought, I don't know this from Claire, one of the issues that came out recently is a piece of information that was taken by citizens in Japan. And they got a similar kind of document looking at timelines between vaccine doses and deaths. And they found a peak at about 90 days, 90 to 120 days in terms of mortality. And it caused quite a lot of upset and consternation because they're saying it hasn't been properly studied. It could be other factors and so on. And so other countries were trying to put together similar patterns of data so they can be looked at in a more objective way. The problem is that the authorities' concern seems to be about people who are against the vaccine campaign. So they perceive them as just being anti-vax and causing trouble. Well, my thought is simple. You should be looking at the information to try and analyze the same thing on behalf of the public. But let's continue to hear what she had to say.
However, I'm disappointed by the judgment, and I just want to explain the reasoning behind it now. So first of all, the request. The request was a really simple data set. So the UKHSA holds the vaccination register, and because of that, they hold the dates of death because people have to be removed from the register when they die. So I asked for the bare minimum. I just asked for 3 anonymized fields. The first, the age at the first dose, when the first dose was given, not at death. The second, the date of each vaccine dose, which would be anonymized, and I'll explain how. And third, the date of death, which would also be anonymized. I asked only for the data in people who are aged over 20, because there's a risk if you go too young that you might be able to identify a child because there are fewer deaths among children. And so I didn't do that. And I didn't ask for anything that would be identifiable about these people. It was just anonymized dates. No names, no locations, no medical records, no cause of death, no link to any identifiable information. Now, I was a bit wrong in that I was a bit vague on what I meant by age, but thankfully the Information Commissioner's Officer helped clarify early on in the proceedings that what I meant was the 10-year age groups that UKHSA were using in their vaccine data publications. Now, to protect privacy, I also proposed adding this anonymization process. So the idea is that you add or subtract a number between -3 and 3. So it could be -3, -2, -1, 0 at random to each date. So that's a standard way of anonymizing data. It's used on data for the living. Now, remember, this data was shared with the pharmaceutical companies from the outset for their safety reporting. So that's the kind of anonymization that they would have had in order to receive this data.
Pausing here a minute, in case you missed that. So in effect, she was saying that they already had the data. They had already probably anonymized it. They had already shared it to pharmaceutical companies involved in vaccine rollout because they would be interested in looking at this data. I don't think, as far as I know, they have published what they have found in terms of definitive looks at timeframes and so on. So they're willing, or they have to possibly share it with them. But you, the general public, don't seem to need to know. Let's continue to listen as we continue with this journey.
Yeah. Now, UKHSA did give us a small low-resolution data set, which was based on what happened every month, but it didn't allow meaningful analysis. But this was much more than about the data itself. This was a point of principle, because UKHSA was saying that the reason they wouldn't give us the data was that the public would not be capable of understanding the information and they needed protecting from it. And this seems inconsistent with the spirit of the FOI legislation, which is that the public has some say in what we see. So UKHSA first rejected my request on the grounds that in order to anonymize the date and vaccination dates, that would amount to creating new data, and they're not required to create new data under FOI legislation. Now, the Information Commissioner's Office, the ICO, initially disagreed. They were really great, actually. They were really on side, and they shared with me case law that supported the point that this was not new data. And I thought that would be the end of the matter, but I was naively optimistic. So after the UKHSA responded to that, the Information Commissioner's Officer did a 180-degree turn, and they said the data couldn't be released because releasing it would be likely to endanger the mental health of bereaved families.
Pause it there. Pause it there. Now, this, in my opinion, seems to be a situation where the ICO, Information Commissioner's Officer, was working in an open fashion, recognized the value of the information, was supportive of what was going on, and probably in their own hearts of hearts thought this needed to be addressed. But as usual, if you work in any kind of system, when you're doing any kind of major change or releasing any kind of information, they would have to go and talk to a higher up. It sounds like when they went to the higher up said, absolutely not. No way are we allowing this information out. Because the 180 degree wouldn't have come from the individual or the individuals they were working with. It's likely it was something or someone separate. And what I genuinely am trying to understand, really, who are they trying to protect? Is it industry? Is it politics? Our friends? I don't know. It's really, really fascinating. But let's continue to listen.
And could fuel misinformation. So at that point, we had no choice but to take the matter to the tribunal. Now, the UKHSA argued that this is their quote, there is a real and present risk that data will be presented out of context by anti-vaccine proponents, which would be likely to undermine public adherence in current and future COVID-19 vaccination programs.
Now, listen, if this is something that I find a little bit difficult in the sense that what we're saying is that the science is not robust enough that if it's challenged, it can't stand up to scrutiny. And so therefore, the only way you can protect your narrative is to censor or prevent scrutiny. of the data. That doesn't fill me with a lot of confidence. You know, you should be able to handle any kind of challenge, and you should be open to listening to concerns, whether or not you agree with them. And that should be an essential part of what we do. Again, let's continue with the discussion.
They also involve 3 additional bodies, the MHRA, NHS England, and the ONS. Now, NHS England helped to provide data on vaccinations and the death data to UKHSA, but the ONS and the MHRA could not claim to be responsible for this data. ONS confidentiality law was cited, even though the UKHSA acknowledged it doesn't receive any of the death data from the ONS, and that the ONS confidentiality law doesn't apply to UKHSA in the context of FOIs. So this is a law that makes it a criminal offence for the ONS or any member of its staff to disclose information that could identify a person from official statistics, including death data. Now, what happened next felt really odd. So what apparently often happens in FOI cases, some of the hearing ends up behind closed doors. So, you know, the judge gets to see what the problem is and why something can't be disclosed. So it's fair enough that it might happen behind closed doors. In this case, the tribunal heard submissions about the risk that deceased people could be re-identified in private. So we couldn't make any arguments about how that was done, and it was pivotal to the decision. So, you know, as I say, this is allowed under FOI closed material rule, that the judge sees the data so can understand why there might be a problem with disclosure. It does raise a bit of a difficult question, though, because how can the evidence be tested if one side's not permitted to hear it? The second odd thing was that the person who was explaining this to the judge was a man called Vahe Nefarian from the ONS. So this was a case where we were accusing the Information Commissioner's Officer of failing to force the UKHSA to release the data they held, which they got from the General Records Office. Yet here was someone from the ONS in the courtroom and talking behind closed doors to the judge. And I had come across him before. So I attended some of the judicial review proceedings around the decision to recommend vaccinating primary school children. And as part of the evidence that was presented in that case, there was evidence on deaths of teenage boys that happened in the 2021. And the ONS were involved in that case, and they admitted to the court that there had been a statistically significant rise in deaths in 2021. But in that court case, the court refused to order the release of the anonymized data, where we were asking for the time from vaccination to death in these 300 boys.
I'll pause it here again a minute, because what seems to be clear at the moment is that the big concern is probably liability. And because, as you can see, say, for instance, in what happened in the US recently, where once there was a questionable link, say, with Tylenol and autism, suddenly a court case against pharma was immediately kicked in. And so there is this kind of fear, because at all levels, industry and government, not only were they promoting the vaccine as safe and effective, but they went the next step further of mandating it. And in that situation, if people were harmed, it is really, really difficult to step away from it. And so we are now in a situation where it feels as though everybody has a reason to collude, because nobody here has certainly any money to gain, because the money goes to pharma and industry. It doesn't go to specific people in these offices. So there is not a lot of logical reason why they themselves wouldn't want to know, unless if there was a problem, the first question to be asked, did you see it? And if you did see it, why didn't you raise any flags? If you didn't see it, why didn't you study it? They're stuck. And I think that this may be what it's about. But let's continue to listen.
And they refused to release it. So similarly, in this more recent case, the Information Tribunal has now heard from him again and refused to order the release of anonymized data, which was just vaccination dates and death dates. although in older age groups. And again, it's because of Nefarian and his colleagues. As I said, Nefarian works for the ONS, and yet here he was in a tribunal regarding UKHSA data. So Nefarian persuaded the judge that anonymizing that we were suggesting would be inadequate. So he'd gone through and found local newspaper reports of cases of people who had died after their COVID-19 vaccines. And he said that it could be triangulated against the anonymized data that we had requested. So he showed evidence to the judge that one such newspaper report could be matched to an entry in the database. And I don't know how he did this, because unless he was using a single age group in the data instead of 10-year age groups, you can't know. But because the discussion was in secret, we don't know what he said. So if you know someone died, but you didn't know if they were vaccinated or not, then you couldn't find them in the data, because there are around 50 to 60 deaths every week of people in their 20s and more in older age groups.
Pausing it here again, because someone put a comment, so I'm seeing comments, is that I thought was interesting. They prosecuted the database manager in New Zealand for the same pretext. Now, I remember this case, and I don't think he had a strong legal case with regards to why he did it, meaning that once he did it, he would be targeted by the organization. But even in this case, where he released a lot of data that was concerning, it still got suppressed. It hasn't been investigated. There doesn't seem to be any interest in terms of understanding what happened. And you have to remember, again, I think this is tied to the fact that there is collusion. People who were involved in the mandates, whether they were political or otherwise, people who were silent on the mandates, if there was harm, there is huge liability. Everybody is now covering their backs. And as was said previously, just remember, for everyone, it is your problem if things go wrong. They will not come to defend you, as we have seen with what has happened with the vaccine injured. But let's continue to listen.
So for the sake of argument, you could identify someone in the data because you knew their date of death and you knew they were vaccinated. Then what have you learnt? You've shown that they are a line in a spreadsheet, but you haven't learned anything new about them. So you haven't disclosed anything. It's also worth noting that the ONS published data each week on the age group and region of every single COVID death down to individuals. Ultimately, the judge based his conclusion on evidence that we were not permitted to see, including a successful identification on the basis of a re-identification methodology we were not allowed to see or challenge. So although it was not discussed in court, it's notable that countries such as the Czech Republic have released more granular anonymized data without causing anyone any harm and without there being any misuse. And I mention this only to show that anonymized release is technically achievable, but obviously doesn't mean that UK law has to follow what the Czech Republic does. So the tribunal ultimately rejected the argument about misinformation as a legal ground. The judgment said that, and I quote, "To have been able to reach a conclusion on misinformation, we would have needed specific evidence, and that evidence was not available. However, the tribunal upheld the refusal on two other grounds. First, that disclosure would be likely to endanger the mental health of even a small number of people." The judge wrote, and I quote,
Pause it there. As I said, you can't handle the truth. Now, in a sense, maybe they're right. Because if it did come out, and in my view, based on the research, and this is something important that people don't understand. Why do I keep talking about this? This is like 5.5 years down the line. There's so many other things I want to focus on, you know. I have a passion about so many other diseases, you know, with type 2 diabetes, dementia, you know, and I'm still focused on COVID. And it's because I know, or I can't say I know, based on the science, there is a very strong possibility that with ongoing circulation of the virus and a highly vaccinated population, this has to be a disaster. That's just what my extrapolation of the science is. And so therefore I have a responsibility to keep attention on it, because if we don't make the link, it means people are going to suffer unnecessarily. But let's continue to listen.
Right. We accept the suggestion that there is a real risk that some people would be contacted about a deceased relative once the data was published. We conclude that for some, but not for others, being approached about this data or finding out about it would be distressing. Now, to reach the relevant legal threshold, the tribunal had to be satisfied that the kind of distress would be likely to manifest in a serious psychological condition such as PTSD. On the basis of an unevidenced assertion by an affairian that it would cause such mental distress, the tribunal accepted that this risk had been established. The tribunal emphasised that Section 38 concerns any person, meaning a single person's potential adverse psychological reaction to an anonymised spreadsheet was used to block its release.
I think they know what is coming. Because the reality is, yeah, if they release this and I get it and I can analyze it independently, I mean, I suspect, and maybe they have already done the analysis because they probably know. And so that would probably be the logical reason that in the context of this kind of pressure to release the data, for them to put up this much of a fight, they probably know that if it was released, it would be bedlam. You know, this would be an absolute disaster for the reputation of multiple sectors. And so what they're doing is firefighting to try and protect as best as they can the reputation of science and the trust of the industry, politicians. And you have to remember, the aim can't be to decimate that. But at the same time, you can't have trust if there is no openness and transparency, especially if there are problems. But let's listen to the end part of her discussion.
Second, the tribunal accepted an argument that producing the dataset would involve too much time and cost. The UKHSA argued that responding to my request would require creating a new dataset that would incur significant cost, but they'd already generated the same underlying dataset in order to share it with the pharmaceutical companies and to demonstrate the identification problem to the judge in the closed session. So I'm left with the question, if the dataset already existed for those purposes, why was it couldn't be provided by the FOI? And in addition, UKHSA even went as far as claiming it would take 76 years to go through each line of the database, doing a 10-minute check to ensure that no individuals could be identified by triangulating with press reports or social media posts. The judge agreed that the time and the cost to produce the dataset would be too much, and so allowed that argument to gold plate the mental health argument. So that's the outcome. My legal advice is there's no realistic cost-efficient prospect of obtaining this data through further appeals. I want to thank you again for your support. We brought the case in good faith. We followed the process. We reached the end of this particular legal road. I will leave the facts with you, and each of us can reflect on what they mean for transparency, evidence, and public trust. Thank you.
Well said. Yeah, we have to reflect on what it means. And but we seem to be at a really critical transition point. And I think in terms of medicine, this kind of situation where there isn't transparency, where the public feels that there doesn't seem to be a determination to understand what was right and what was wrong, it then destroys the trust that had taken so long to be developed. Again, I can only say on behalf of my medical profession that it is sad that after being hailed as heroes in 2020, where the doctors, the nurses, all the health staff went and faced this pandemic, we lost colleagues, people died, we still have the trauma of it. And to then see that decimated post 2020 into 2021 and onwards, largely because I think we didn't continue to advocate for the people whose lives had been saved and whose lives had been served. That's a lesson to, I think, medicine, because at the end of the day, we haven't gained anything from this. All the money has gone into pharma and all the connected things. Reputations have been lost. I don't know if there's any easy way to rebuild it, but the first thing we need to all do is insist on openness and transparency, identify the problems, and be honest about where we were right and where we were wrong. Without that, it only harms the public to not trust the people they have to trust when they really are sick. Thank you for listening, and we appreciate Dr. Clare Craig for her invaluable work. And I hope you can continue to support her in what she does on Twitter and Substack. Have a great evening.